Hi, I'm Dr. Rose. I'm going to be doing your facial reconstruction surgery on you today. I just need to have a quick look at your wristband just to confirm we have the right person. So if you can confirm your full name and date of birth. Fantastic. And do you know what day it is today? And the year. Super. Now we're pretty much ready to take you into the operating room straight away. I do just need to get prepped for the procedure. We're also going to just prep you as well for the anaesthesia. I'm going to begin just by washing my hands. Okay. And also get myself gowned and ready to complete the surgery for you. So if I start with my gown here. And gloves. Perfect. And my mask. Fantastic, thank you so much. So as long as you are feeling ready, we will get you anaesthetised and we'll complete the surgery. So I do want to get you into a more comfortable position. We're going to have you laid down, which is how you'll remain throughout the surgery. Okay. Okay, so we are going to place this mask just over your nose and mouth. I need you to take in some nice deep breaths for me, and you will then drift off to sleep, okay? Okay. So some nice deep breaths. Okay. Just stay taking some nice deep breaths. We'll see you on the other side. Okay. Right, I need my pen to begin with just to mark out the area. Yes, so we are doing facial reconstruction to the left temple here. We can see the patient has had some scarring which is healed improperly, so we are just going to do a minor incision. We're going to just check the fat deposits under the skin to make sure everything is okay. Just take a little look under there in general to see if there's anything we need to do, and then we'll just get them stitched back up again. Okay. Right, can I have a scalpel? Thank you. Okay, may I have some forceps? Just going to open the wound or the scarred tissue just to see if there is anything that we do need to do here. just going to take the edges of the scar tissue so we can then pull that together and restitch, making a healthy more invisible scar. Okay. Let me just have some of the blood. Please keep an eye on how many pads we are using for blood. Okay. I need my needle. We're just going to begin by doing a couple of internal sutures. And we will then finish by closing it with the external sutures. Now, can anyone here tell me why we may get more bleeding on the face and scalp? Yes, because we are closer to the heart and blood vessels, we do typically find heavier bleeding in these areas. But we do also find, because of that, the healing process is fairly easy as well. Now, with the way we have done the internal sutures, the skin is sitting very flush, so the patient will have a very minimal scar. So yes, we do now do the external sutures. The suture colouring we use here is just blue. Yes, let me just clean this up a little bit here. Now, what I may say is the patient has asked us, just due to the fact that we have done some reconstructing on the left side, that we do make the other side equal. So we're not going to be giving them a scar, but as you can see where we have removed tissue from this side of the face, and the skin has been stretched together to stitch the skin back together, it's given them almost a facelift effect. So what we're going to do is make a very small incision just on the right side of our patient's face, just along the hairline here, we're going to do the same thing. So we're going to take a very small amount of skin. We're then going to pull that back to the skin of the scalp, stitch together, and it will give the same lift that it has given on the other side. This is obviously not typical practice. The patient has paid for and requested this, so okay. So same process again. We're going to be using a scalpel. Thank you. And just here in the hairline is where we will make our incision. And forceps. Thank you. Just again, I'm going to look in the wound, make sure all the fatty deposits are okay. Okay. Scalpel. So we will remove said amount of skin, sutures. Again, we will do the internal sutures to begin with. And we're pulling that skin nice and tight. Now, you can see we have more facial symmetry, so we have eyebrows at equal positioning. Yes, it has almost given a more of an arched effect where the face has been lifted, but we're also just making sure there is no effects to the patient's facial movements as well, which we will confirm once they are awake. I'm just going to pull down on the lower lids. Yep, seems good. Reactivity there, everything is going to back to as it should. Yes, we'll now do the external sutures. I'm happy with our work. If we just want to take the patient back through to rehabilitation, we'll do an assessment in approximately half an hour just to see that everything is okay. Perfect. I'm assuming I can trust you to adjust the patient's head. Thank you. Hello, how are you doing? Feeling okay? Good. I'm just going to do some hand hygiene just before we have a little look at your face. Okay. But you're feeling fit and well in yourself? Yeah, not too much pain. Super. Surgery went very well. We corrected the poorly healed scar that you had on the left side. We then did the corrective surgery to the right side just to make sure we had good facial symmetry as requested. Yes, let me just have a little look here. Okay, if you could just do a smile for me. Good. Can you raise your eyebrows? Excuse me, I know that may be a little painful at the moment, especially on the left side where you have the scar running quite close, but if you can, just raise your eyebrows. Doesn't feel too tight. No? Can you frown for me? Again, no intense tugging at all. It feels a little unusual. Yeah, I mean, that's probably likely just due to the fact you have some fresh wounds essentially, but once they heal, everything should be fine. I'm just going to have a little look in your eyes here. Okay, I'm just going to use a torch and just check pupil dilation here. Good. Can you puff out your cheeks for me? Can you suck them in? Yeah. Can you open your mouth really wide? Good. Okay. I think you are all okay. Surgery went great. We will keep you here just for a couple of hours to monitor you. There was no intense blood loss or anything severe that you need to be concerned about. Everything really went swimmingly, but we'll just keep you here for a couple of hours to make sure you are okay. Sometimes when you get up you can feel a little woozy, so we do encourage you just to walk around your room that you have here. Any issues, do ring the bell. We can help you with anything. Do you want to drink of anything at all? Just some water? Yeah, we have a picture here of water. There you go. Yes, keep yourself hydrated. I will come and do a final see over just before we check you out. Okay, you are very welcome. Thank you.